Hey, good afternoon, everybody, and thanks for joining us here in our studio at the Public Safety Training Academy. I'm Captain Machala, and we are joined here by a couple of guests for a special episode, EMT Recert update, which we've coined between two Band-Aids. We're going to have a little discussion on the new EMT Recert process, so I'm going to get right into it. We'll try to keep this to about 60 minutes or so. If you guys have any questions for the panel, please enter them into the chat. We'll try to answer them as best we can while we're here live. If you're watching later on, we'll cover how you guys can ask any follow-up questions later on. So I'm going to go ahead and introduce the panel. So to my left here, we have Captain Hayunga, who is the EMT program manager here at the Training Academy. You're probably familiar with if you've been through the Recert process at all. We have Dr. Stone here, our medical director, joining us also. And then our outside guest is Aaron Edwards, who's the director of Clinician Services at MIEMSS. So thank you again for joining us here. It's nice to have the subject matter expert to help answer some questions and clear up some things and little nuances about the new EMT recertification process. So thanks for joining us.
Well, thanks for having me.
Absolutely. So again, we'll just get started. Please, again, ask questions if you have them. We'll try to fit them in as we can. So to start off, let's just talk a little bit about why did the recertification process change? So why did these standards change? I guess what was the process that went into making some of these changes and decisions?
Well, from what I understand, it started about 2 years ago. They brought it up, and there was a lot of discussion throughout the different groups within MIEMSS and throughout the state. And they saw that the skills sessions don't necessarily need to take 12 hours. Most of the skills can be done in a short amount of time, and we're not really counting all the other hours that people are getting during the skills or the other didactic stuff, whether it's in CPR, it's 15 minutes to do this actual CPR skill, but all the other stuff that leads into it. So we found that trying to find a way to actually see what that information was or what people were learning, as well as getting categories that more closely resembled what National Registry has. So that's what the categories came out. We're not going to change them off, and once we go through some time, a couple of years, 3 years, 4 years, we'll start looking at maybe there's something else we need to do. It also gives people the ability in each jurisdiction to do the training that they need, not specifically what we're saying that needs to happen. So it gives them 15 hours of specific categories that we want to see covered, that the medical director decides, and throughout the meetings that he has with all the other medical directors, they can make a decision.
So basically, we're trying to make the most efficient use of our time during Recert and
exactly
get us what we need. And I kind of neglected to do this in the intro. So as part of your duties as the director of Clinician Services at MIEMSS, is this, as far as like the recertification process, a lot of what you do, or is it outside? Like just a brief overview of like what your time entails.
The Office of Clinician Services, we address all licensure, everything, whether it's renewals or reciprocity, initial. We do all the initial psychomotor testing for all EMT classes held within the state of Maryland. We also do all not licensed, but we approve all the educational institutions and educational programs that we have within the state. So like Montgomery County is an educational program that can do initial and paramedic and all of those, and we assist them.
Okay, so you're kind of like the credentialing almost?
Almost. I think we want to partner with everyone. Mm-hmm. We want everyone to, not look at MIEMSS as the mothership type of thing, the oversight. We want to help in any way we can.
It allows for continuity, I guess, right across all the programs.
Yeah.
So I guess recertification is just a small part of what your office does then.
Yeah.
Yes. Captain Hayunga, do you have anything on that as far as, or Dr. Stone, as far as input on why we changed in this new process? Or because I want to get into what the process entails here shortly.
So first of all, I did want to take a second to express how thrilled I am to be here today, how honored I am to be here today, as this venue provides an opportunity for us to address what would otherwise be very difficult to try and get to all folks, one station, one shift at a time, given the over 1,100 career clinicians as well as several hundred active clinicians on the volunteer side of the accommodation house. I feel like I wanted to shout out to each and every one of you to let you know how much we appreciate what you do every single day. And so this is an opportunity for me to pretend for a moment like I'm with you all, each and every one of you. And this discussion is certainly a milestone in what I think is, moving forward and modernizing our educational approach to the BLS clinician. I also wanted to say, again, and those who know me have heard me say this probably time and time again, and that is that basic life support is the cornerstone of EMS. I have, for instance, when you look at cardiac arrest, even the science is saying, for instance, that in a cardiac arrest, ALS is the guest, right? It's a little jingle that I came up with some time ago. And the point of that is before we can have any fancy walls or crown molding and flooring beneath our feet, we need the joists, we need the infrastructure of basic, solid EMS response that's made to both take care of lower acuity patients as well as take care of our higher acuity. And without BLS, we can't do that. And so when we have innovations like this, I see my role as a cheerleader for the operational implementation. I've always had a small faculty role in actually doing some direct teaching, and also as a medical barometer or a medical consultant to the educational content. And related to that, I would say that, for instance, when you were talking about MIEMSS not being just a credentialing authority, but really vetting these with representatives throughout the state, I can tell you, for instance, that when they do site visits for all of the educational programs, BLS, ALS, continuing ed versus initial education, they include the local medical directors there. It's actually a constituency on the site visit. So the credentialing is done in a collaborative fashion with everything. And so my role here is to be a cheerleader for the process. And one more thing, it's a shout out, just like it's a shout out to all you clinicians one by one. This is a shout out to all the folks who participate in what I call a subspecialty of EMS educational curriculum development. It's not just the faculty, but it's the curriculum development. People like John Mack and Brooke and other people who work, and Captain Schaefer and innumerable others that assist in the adjunct faculty. Those are curricular experts and in their own way, and that even transcends my role as the EMS physician. So it's a shout out to everybody, and I wanted to make sure I acknowledge that in the beginning. And one more thing before I toss back to you all is, when we look at the old curriculum, the 4-4 and 12, the 4-4 and 12, I'm sorry, 4-4-4 and 12, when we only had the medical and the trauma content, it left the potential for many of the new innovations or new data that was coming up about how to best take care of a patient, potentially left those on the table for, and maybe it would have missed out on being able to teach some newer innovations or information when it's just medical and trauma and no other, nothing else. So when we look at the new 15-hour breakdown and we see that in addition to trauma and medical, we have toxicology, peds, OB, cardiology, and airway, this gives you an opportunity to be a real lifelong learner in areas that are bread and butter in EMS and BLS specifically. I'll give an example. Adding the 1 hour of OB addresses an area where we can have the ability to have consequential influence on better outcomes for pregnant patients. So whereas it wasn't there before, now we make sure that we bring that education to other people. So that's just one example. So I think that's how the 15 hours release helps.
Yeah, so I think that's a good segue into the next part, right? So it shows that this recertification process is a critical part of establishing that foundation. So we're going to give it to Captain Hayunga. So you can see up on the screen now the new process, right, the new hour breakdown as far as EMT recertification is concerned. So as it relates to the new process and the new breakdown of these hours, do you want to speak a little bit about how do we meet those requirements, or what classes does a clinician or a provider in Montgomery County do we need to take now in order to satisfy those requirements?
Absolutely. So as Aaron and Dr. Stone have mentioned already, the collaboration and bringing this curriculum together, then it's got to be brought in front of the legislator to be passed by COMAR, and then when that happens, it's a sudden change that we need to, be meeting that standard, but it's pretty sudden once that goes into law. So, we're used to the 12 hours of online. the 12 hours of skills class. Now we're moving to this 9-hour skills checkoff. And one of the things that we want to emphasize is that this is a skills checkoff, right? As Aaron alluded to, we would spend some time checking you off and then a bunch of time teaching previously. The expectation is that you're going to be coming to the academy ready to demonstrate those skills to the instructors that are at the academy. So there'll be a 9-hour skills checkoff, and then there's 15 hours of didactic content that needs to be made up. The categories are there: the airway, the cardiology, OB, peds, toxicology, trauma, and medical. And in order to introduce the least amount of change to our clinicians, right? We've got a big change in the content. We want to keep the process as similar as possible. We chose here at the academy to keep the 12-hour online class. So on September 1st, the new content for 12 hours of online started, and that will be continuing throughout the semester. And then we have a 12-hour skills class, but only 9 of those 12 hours is the skills checkoff that we're talking about. So we'll spend the 9 hours doing the skills checkoff, and then we have 3 hours of didactic content that meets the other 3 hours from the 15 that are not covered by the online section.
Okay, yeah, that makes sense. So is there a specific order or anything that we're going to, I guess we'll probably get to that a little bit later, right? If we've already taken some of our classes. Do you want to talk about that, like the order of taking the classes, or you want to do that now?
So so there's not a specific order to the classes that you need to take. So the biggest change is going to be that we have this new curriculum and this new standard that we need to meet. So the classes that started in September, our first round of EMT Recert for the county started in September, the online starting on the 1st, and our first skills class being on the 20th of September. So if you have not done anything for your EMT Recert, you are getting ready to expire on the 31st of January, and you haven't done any classes, then what you need to do is just sign up as you would previously for the 12 hours of skills, 12 hours of online, and that will meet all of the requirements for your EMT recertification.
Okay, you just want to walk, sorry, real quick. So just want to walk through how to do that in case people aren't familiar with that now.
Absolutely.
Just to remind people of that process and how they can find those classes and
Absolutely.
everything.
So in order to find the classes, you're going to go to Quick Links. And from Quick Links, you're going to go to the PSTA webpage. On the PSTA webpage, you're going to go to the banner for EMS classes, course schedules, and EMT recertification. And on that page is the entirety of the course schedule, and then the FRS all email that went out to all of the clinicians. All of the information that is on that email can also be found on that web page. It's a top link at the top of that schedule page. So you have the entirety of the schedule, and then you have the link to explaining all of this process as well on that page.
Cool. And I see in your notes, obviously helpful for people to know, or there's probably some trepidation about, hey, I'm going to walk into this class now and be tested for 9 hours, right? So to review, obviously we're more familiar with some skills than others depending on the frequency that we perform them. Is there a way that people can review before they come into the class and are expected to basically be tested on these skills right away, or what's the best practice for that aside from just company training?
Absolutely. So, and I'm glad you said company training, because that's really where we need to start with this. So when you go to the link that was provided in the email that's going to be on the that is already on the website, there is a list of the 27 skills that needs to be checked off while you're in the skills class. And every single one of those skills has a hyperlink to it that ties back to a training video that we have on the EMT section of the PSTA website. So all of these skills have training videos up. And I would ask the company officers to really focus on, especially with this first semester of transition for folks, to really focus on making sure that their employees are coming to the academy ready for those skills by making those station drills and not just watching the video, but actually demonstrating it, right? These are skills that you really need to have the muscle memory for, just like the majority of the skills that we do in our job. And so, break some of the equipment out, practice with it. If we're doing that, then I'm positive that there won't be any concerns when we get to the skills checkoff day when you come to the academy.
Awesome. All right, cool. Thank you. So a kind of thing that kind of, unless you guys have anything to that end, we'll kind of keep going.
So I would only add that one of the changes that makes this very relevant and cogent is the fact that we all know that skills are degradable and perishable, and what this change does is make sure that we're not, for lack of a better word, sort of just breezing through these opportunities that may have been kind of the way that the old system may have kind of allowed folks to do. These 27 skills were chosen because this is really where the rubber hits the road and what you may really encounter as a BLS clinician. And if you run a call and you know it's been in your class, you know it's part of what you've done before, but you just don't see it on a regular basis, reviewing the skills checkoffs, getting your hands on the hands-on practice is more likely to make sure that when you actually have a patient in front of you that needs the skill, that you've been introduced to it more recently. So I think that is something that we have to remember. We're lifelong learners of new things, but we also have to be lifelong practitioners of the established things. You could liken it to, you could do a sports analogy. I happened to minor in music in college and I loved it. And if you don't pick up your instrument and play it regularly, you're going to get rusty. So that's the way to look at it.
Yeah, so I have a question. I guess it's probably directed toward you, Captain Hayunga. As far as with the skills checkoff, so if I walk into my 12 hours at the academy and I'm, say my epi drop, I don't do correctly or I misdose it or whatever the case is, I don't know all the contraindications. Am I getting my EMT card pulled? Am I getting kicked out of the class? Like, is it like a remediation process? How does that work?
So our goal is for you to leave that class ready for your EMT renewal as you have in the past, right? So come into class prepared to go through that process, watching those videos, doing the station drills is the first step, but there will be more than one opportunity. There is time built into the class so that if epi draw up was the skill that you were struggling with, right, we're going to provide you some one-on-one coaching to make sure that you are comfortable with that skill. We'll ask you to demonstrate it again so that as we leave, we know that you are comfortable with that skill, but there will be more than one opportunity to receive some one-on-one coaching on a skill that you may be deficient in before we have you leave the class after those 2 days.
I think that's important for people to realize that so it's rooted in education, right? A good education concept of learning it and then just being able to, I guess, validate that knowledge base. And so it's all about learning, not punitive, right?
Oh, absolutely. Absolutely.
Cool. All right. So to make sure we hit everything, I guess we'll keep moving through. And I think this is something that's going to be Aaron and probably a little bit of you also. So if we've already taken, so say you're in that group of people that maybe has already taken the 12 hours of online, you already taken part of the classes for your recertification. What does that look like now? What if they've already taken 12 hours online? Are they just going to be able to jump in? How does that work?
No, I appreciate that question because it really is what we're getting most of the email questions about since we made the announcement of how this stuff was changing. So if you've already taken the Montgomery County online class, come to the academy, take the new skills class, and between what we previously had and what we currently have, everything's been if you've taken the old skills class and the new online, then you will be good to go, all right? If you previously, before July 31st, you took the skills class at the academy, now you're signing up for one of our online classes, then you will be good to go. Your EMT will be ready to go. You'll apply on November 1st, and then you'll be renewed. If you took the old online and the new skills class, then there is a little bit extra that we need to do to make sure that you meet all of the new requirements of the EMT renewal, and that will be a simple little 2-hour session that we're going to add to your online to make sure that all of the topics are hit. So if you've done the old online, the new skills class, we just need to add 2 more hours to make sure you've hit all the category hours that MIEMSS is now requiring.
Okay. And I guess if anybody else has a specific question on like their specific scenario, if they're not sure, if they can't remember, whatever, they can obviously email you and you guys work that out. And then after this is all done, the process is still the same, correct? Go to the MIEMSS website, apply for renewal. None of that's changed.
No, we haven't changed any of that portion of it.
Okay.
What I want to reiterate with or mention with this is the amount of work that Captain has done and how he's married the things up, and the people in my office also looking at it, and it's not just the one jurisdiction, but we're all, we're here to work with you. So if anyone has any questions and they can't necessarily be answered here, you can always email our office, call our office, and if we don't answer the question right then, we'll get back to you. We'll figure out a way to work with everyone. We want to make sure people understand that we're not just, oh, here's a change in regulation, sorry about your luck if you don't meet it. We're here to work with people. So just want to reiterate that portion as well.
Awesome. Yeah, and we had a question come in from Chief Sherburne, and it's actually something that we talked about earlier prior to the episode. So good before we continue on. Good time to ask that, I think. So the question was, is this program standardized throughout the state, and can skills sessions still be done through regional MIFRE classes? So do you want to touch on that real quick, or?
Absolutely. So all of the teaching institutions in the state are all developing programs to make sure that they're meeting the new standard for renewal. And so we're all going through this transition period. And while we're going through that transition period, my recommendation would be that you do the entirety of your renewal with one organization, right? So if you're doing Montgomery County's online, I would suggest doing Montgomery County skills to ensure that all of the new standard is being met by those two classes and that you're getting everything you need in order to get your renewal. If you're doing MIFREs, not a problem for you to take MIFREs classes. MIFREs classes are going to meet all the same standards that Montgomery County's classes are meeting. But how they're choosing to break up their classes, how they're choosing to meet this transition may vary. And I would not want to see somebody be caught up in not exactly having all of those hours met in that manner. And so the best thing to do is, if you're going to take, MIFRE's got some 24-hour classes listed currently. I know they've got some other stuff that's going to come up on the schedule. If you're going to take MIFRE's classes, by all means take MIFRE's classes. But for this transition period, I would stick with MIFRE's classes or stick with Montgomery County's classes. That way we know for certainty that all of those standards have been met.
And I'll go ahead and say that MIMFRE, we're working with MIMFREs because they do have the bulk of the research of the people in the state. So we're working with MIMFRE's old curriculum, and we're mapping it out right now. We're almost at the end of it. Probably by the end of the week, we should have that fully mapped out. It appears that if there's an hour of the old curriculum, there might be an hour, but I don't even think that that's the case right now. We have people looking at that. And as far as if you took a skills and an online, we're diving into that right now to see what you would need to take before January 31st. But it doesn't look like there'll be much at all. And we will make sure that we have stuff offered online on the online training center to make sure that people are going to be covered. Again, we're not leaving anyone out with this. We're going to make sure that we have what we need. If there's anybody who has any good training that they've put together, we're more than willing to take it, and we'll take a look at it and see if we can actually add it to the site so everyone can get it. So,
a corollary to what Chief Sherburne was asking, and I don't know if someone asked a similar question on top of that in the chat, but I wanted to at least address so that we're sensitive to the question if it came up, whether or not people remember to ask it in the chat, and that is a good part of our contingency on the volunteer side of the accommodation service has chosen, people have jobs of all different kinds, and then they're weekend warriors. But some of those weekend warriors have chosen a career also in EMS and other areas like private ambulance, critical care transport. They're moonlighting paid somewhere, but then they're also putting in their volunteer time. Unlike some hoops to jump through with credentialing on the ALS side with our professional development program, if someone goes through entirely their work, which is an EMS-related work, and finishing their work, will there be any additional EMT requirements just for Montgomery County like there is for ALS? Or are they as long as they renew through their one jurisdiction, they can continue to volunteer without any other thing they need to do as long as it meets the MIEMSS standard. Am I correct? And I think it's worthy of noting that because we have people in these situations very frequently.
No, absolutely. So at this time, there is no differentiation for Montgomery County Fire Rescue, career or volunteer. If you have met the MIEMSS standard and you are renewing, then you are still affiliated with Montgomery County Fire Rescue as an EMT with no concern as to where you obtained those classes, which also brings up, which we didn't get into as much, which is that, this is the renewal classes that the majority of that we're doing. This is the renewal format that other jurisdictions within the state are looking to, but the other pathway to keep your Maryland EMT card would be to renew your national registry and keep up with your protocol updates. And so if you're doing those two things and you're getting your national registry hours elsewhere and you've met that national registry standard and you've kept up with your protocol updates, that will also meet the requirements for a Maryland renewal.
Yeah.
All right. Yeah. Do you want to touch on? Well, actually, we had one more question come in. That was two now. So one relates to something we already talked about, so we'll hit that one first, even though it came in second. So just to confirm, currently signed up for EMTB Recert 12 hours online with an October start date. That person would be okay with this class, right? All the classes forward here are in this new format, correct?
So everything as of July 31st had to meet this new format.
Gotcha.
So our classes that started on September 1st all meet that
Gotcha.
requirement.
Yeah, and if people have individual questions, obviously you'll take a look at the individual circumstances.
Absolutely.
and make
Email
sure we're
me,
good to go.
and
We
if
will
I
too.
can't- Yep. I was
You
gonna
know,
say, if I
whatever you
can't-
need.
If I can't answer the question, I'm going to be forwarding that to MIEMSS to get a clarification on it, so we make sure everybody's where they need to be.
Excellent. And another one related to the process, which I also think is a good question. So I guess this would be for Aaron. And if we've done it here in Montgomery County with our format, has the new method of Recert been beta tested for effectiveness and/or pass rate? So obviously there was a lot of development time that went into it and thought, stuff like that. But as far as the format, I guess.
Well, that was prior to me arriving at MIEMSS. I've only been there since October, and they've been doing this for 2 years. I think there was, we haven't done any beta testing, as far as I know. They did do some testing on the skills, and that's why the skills is 1 to 9 hours. It's not just 9. Within our system, we went out. They thought that we could do it much quicker than 9 hours, and they went to a couple different places and sort of ran through how the skills flowed, and the quickest people were 2.5 to 3 hours on doing it. And that was people who walked right in, could do everything and walk out. So they realized it wasn't just a quick hit. So we needed to have sort of a sliding scale that gave people a little more time for that education portion or that remediation type stuff. So that was as much beta testing as I think we did.
So that's beta testing.
Yeah. And then while we had a lot of time to sort of plan that this was going to happen, we never knew if it was going to change. So we kind of had a basic layout. And then June 8th, it was like, here you go. And normally we have a lot of regulations and they extend a little longer. So we have a little more lead time and we have a little more time to work it in. This one was kind of quick. So we're working with it, and that's why we're saying anybody who needs some help, let us know. We're going to figure it out.
Very good. And so we mentioned NREMT, so I'm going to skip out of order here a little bit so we can talk about that now, since you mentioned that as it relates to your recertification, depending on if you have NREMT or not. So how does it, I guess, impact your application for your NREMT renewal, and how does that all interface?
Absolutely. So it actually simplifies it. It simplifies it greatly. So what I've got on the screen here is the new 2025 EMT Recert. And so in the middle column is how that meets MIEMSS's new standard for the categories that we need to hit with our training. And on the right is the National Registry category. The first thing I want to do as we're looking at this screen is say a huge thank you to the folks who helped me create our new 12 hours of online content. Way too many folks very much involved in that process to list them all out here. I sent a 67-person email the other day. That's how many folks were involved in making the great content that we have for our next round of EMT Recert. But as you can see the breakdown here, the all of the categories line up on the left. I color coordinated those to see the different categories that we were needing to reach for MIEMSS' standard that you just saw of the 15 hours. And then when you match that with the different categories that the skills fall into, we are very clearly hitting all of the 20 hours of national content for National Registry. So when you renew for National Registry, it's a 40-hour renewal every 2 years. It is 20 hours of national content and 20 hours of state and individual content. And so our EMT Recert class covers 24 of your 40 hours. And by taking the current setup that we have for Montgomery County with the 12 hours of online and the 12 hours of skills, with 3 of those being didactic, you are meeting all of the 20 hours of the National Registry content. One of the things that I did as we rolled out our new online class is that I removed the ability to print out certificates for your own class. And what I'm about to mention seems a little nitpicky, but it's really important to the process for National Registry. So National Registry says that they will only accept 2 types of classes for your National Registry renewal. They will accept what they call CAPCI classes, which is a national standard for certifying a renewal class, or they will accept content that has been approved by the state. And so this sounds like a little bit of nuance, but when you take a class with me with Fire Rescue 1 Academy, it is not approved by the state until I submit it to MIEMSS and the folks that Aaron works with approve it and say, yes, this is acceptable as Maryland topics and Maryland content. And so to print out a Fire Rescue 1 Academy certificate actually doesn't quite meet that standard, even though we know it's going to be approved by MIEMSS if it's the continuation of the same classes we've been doing. Until MIEMSS puts their stamp of approval on it, it doesn't actually meet that National Registry standard. So I've removed your ability to print out your own certificates. That way, as we upload it into MIEMSS and you're using your MIEMSS transcript to put in your application for National Registry, then we know that all 20 hours of your National Registry national content have been met, and we know that that will be accepted by National Registry, and we won't have to worry about any kickbacks in the process, or if you get audited, we don't have to worry about, providing all this extra documentation showing how the process went through, because we've already demonstrated with your MIEMSS transcript that it's a Maryland-approved continuing education class that you're taking for your National Registry.
And the question was asked, is that chart available somewhere? Will that be posted? Or?
So that chart, if you go back, so in the FRSL email that I sent to the county, it is in there. It is also, as you go through quick links to the PSDA site, to the EMS webpage where all the class schedules are, there's a link where all of this information is on that link as well.
Awesome, thank you. Any other discussion on NREMT or the process?
Sure. I did want to mention, just for everyone's edification, one of the reasons I'm able to see this is when I renew the paramedics using the National Registry portal, all of the clinicians that are affiliated with Montgomery County through the National Registry will show up. I can filter, and at my last check, and correct me if you think I'm not quite in the ballpark, is about 200 somewhere between 200 and maybe 250 clinicians have decided to keep their registry after the first research cycle. In other words, you have to take the registry exam in order to pass the initial EMT class, but Maryland has not maintained itself as a registry state for BLS in terms of mandatory ongoing registry certification. So it seems to me around 10%. Does that sound like a ballpark of folks have chosen? And I think it might be helpful to just, for those folks who are maybe not quite recertified for the first time, but are thinking about, staying registry certified, what the advantages would be for the EMTs in Maryland to decide to go and do that. And I thought I would ask both our experts that. I have my own bias, but I wanted to ask you what you think the advantages are if Maryland doesn't require them, and that could inform them about whether they want to continue with the registry.
Well, it makes this process a lot easier. It really does. If they keep their National Registry up, I was actually going to bring this up about the renewal. When you go to renew in your national registry, since this will be the first round that we won't necessarily need to have all your education in your system, like with the paramedics. Currently with paramedics, we don't have to have anything within their education within the state. We don't have to have any special, or we don't have to have the full 60 hours there, because people will take the national registry, and if you have all the stuff in national registry, like you mentioned Fire Rescue 1, that can auto-populate national registry and give them all the CAPC stuff where it's supposed to be. So theoretically, all you would have to do is fill out the application. We would take a look and make sure you did your last 3 protocol updates, and then we have it would automatically communicate over to national registry. It would pull in your new registry card, and you'd be done. Wow. And it could be done within a day. And when we get to reciprocity later, we'll talk more about the process, because we were talking about that. So yeah, I think would be great for that.
Do you see?
Yeah, I mean, so with national registry, if you're keeping your national registry, right, you've got a nationally recognized certification, right? And so that adds, we're always talking about trying to professionalize our career pathways, and this is definitely a way to maintain a national certification saying that you are capable of performing the skills that we are saying that you're capable of doing. And so you have a national certification saying that you are able to do this. If, whether it's, post-career here or as a volunteer, you're working somewhere else, right? That's the most common pathways that I see people following through with maintaining their national registry. I think the challenge that people have always found is that the Maryland cycle and the national registry cycle don't match up. And so there's this hiccup that occurs at the 6-year mark, right? You take your EMT class, you're good for 2 years with National Registry, 3 years with Maryland. You take a Recert after your 2nd year, that's good for National Registry. It's also good for your next 3 years for Maryland. And then you have this little gap where, okay, now I need to get all these continuing education hours for National Registry, but I don't need them for Maryland. And I think that's where people have found that's where people have not always followed through, is that when they hit that point, you ask, why am I taking all these extra hours? The value there is the national certification and the ability to move outside of Montgomery County and Maryland. But some people find that that's not worth the extra effort that is required to maintain that.
So you definitely hit the advantages I was thinking of, and that is, mentioning the career choices that some of our volunteers make, for instance, that include EMS outside of the area. It would, in places like maybe Pennsylvania and DC, and I'm not sure about West Virginia or Virginia, there might be some advantage there to continue. And so I thought it was worth to mention that about 10% of our folks have availed themselves of that, and I think they could vouch for what did it for them. So thanks.
Absolutely.
Do you have anything else, Aaron, on the National Registry? Because I know we want to talk about reciprocity also.
It will
segue into that.
It'll segue right into that.
Go ahead.
So every day we probably get 2 to 3 license verification forms, and those license verification forms, somebody's applying to another state. They're going for college. They're going for something else. Their family's moving. They want to take their EMT over. Lots of states will accept a national registry. What our new EMS or our new EMT reciprocity is going to do is it is going to streamline our process. You're going to put in an application. It goes to Office of Integrity, do a background check. Then after the background check, or while they're doing the background check, people will go on and do a protocol orientation. The background check comes back, the protocol orientation is there, it automatically talks to National Registry. National Registry comes back, says, yes, they're good. You are done with the first portion. You're inactive at that point. You're an inactive EMT with an EMT license. Then you just go to whatever jurisdiction or company you're working for, and they will do a skills verification and sign you off saying, yep, they're affiliated with us. So theoretically, in 2 or 3 days, you could have a license in Maryland if you come in with National Registry. Many other states are similar to that. So I think that's one of the things that we want to, another good reason to keep National Registry. So.
Now, has anything changed with the reciprocity process as far as somebody comes in with the new recertification process? If somebody comes to you from another state, and I don't know exactly which states come back, but they don't have National Registry, let's say, and they have state EMT from another state, has anything changed as far as how that works now?
No, they'll have to send a letter to the state. We're trying to streamline that process as well, but it takes a little bit of time. They'll send a letter to the state. The state says, "Yep, they're our EMT," and then it comes back. Often those take longer. We don't, with the number of people that are doing it, it takes a little bit longer for it to go through the process. That process, then, I mean, literally, it's the program talks to National Registry. It's all automated. The first section of the reciprocity for us is now automated. And most of the other places, a lot of the other places use Image Trend. So they are able to also automate that with National Registry. So, yeah, it's.
All right, cool. Well, that seems pretty self-explanatory and streamlined. So I mean, that's the end of our hot button topics, our main topics. Is there any other, I guess, just roundtable? We give people a couple other minutes to ask any questions in the chat if they've come up. Any other points that you guys have, good, bad, and different, just general on the process?
So I did just want to ask Aaron. So in the past, when you wanted reciprocity, you went into e-licensure, you put in your application, you went and took a skills class, did the 12-hour skills class, and that was kind of the segue into getting the card to be kicked out, saying that you have completed all the requirements. With the skills verification that you mentioned, then going to our 12-hour skills class, which has the 9-hour verification in it, would be the process that our clinicians that are wanting reciprocity to go through.
Yeah.
That's what they would need to do to meet that standard.
Yeah.
Because I know that's been for both our recruit training office when we hire folks who have already had outside credentials, and for a number of our volunteers, we often have volunteers coming in with outside credentials. That's a question that they've been asking over the last few weeks as we've been navigating this transition.
Yeah, I got an email this morning from somebody. So and that would be what we would consider. And you had already said that if they took a MIEMSS skills, which is going to do the same thing. That's good to know. Yeah.
And the protocol orientation is coming through the MSOP, or is that coming through you guys?
It's the EMS Online Training Center.
Okay.
What they'll be sending an email. At one point, it was 4 emails. We're trying to whittle it down to 1. And within that email, here's how to sign on. The reason that we went to this new process to streamline it is before there would be an e-pens number made, and then there were all these different avenues that people needed to take. This allows it to not get lost, not sit anywhere. We're going to continuously look at it, but it allows the clinician or the person that's applying for it pretty much has leeway on this. Our Office of Integrity is phenomenal. 24 to 48 hours, 1 to 2 days. It's in the office and it's out of the office. So they deal with that. When they sign up, they'll automatically be given a new license number. One of the things I guess I should clarify also that we're just finding out is if they were currently a driver, like some private ambulance companies have people and got the e-pens and they were a driver, so they'll have a number 23 and then some digits. That number will no longer be their number. This new process has created this new licensure number. So it'll be, this year it's 25, next year it's 26. In order to streamline the process and allow them to sign on to the online training center almost immediately, within 10, 15 minutes, they should be able to sign on the online training center. They go down to exams, quizzes, they go down to protocol orientation, they do the BLS protocol orientation. 2 hours later, they're done. That will feed over to their education, and that box is checked. So overnight.
And I'm just going to repeat that again because I know that's been a question that we've gotten a lot of. So if you want reciprocity, you put in your MIEMSS application. You'll be given directions to go to the online training center to complete your BLS protocol familiarity. You complete that, and then you come to us for a skills verification, which for Montgomery County, that will be the 12-hour skills class, and then you'll be complete with your reciprocity.
Yep.
All right. Dr. Stone, do you have anything else to
So,
add? We'll go around.
Logistically, on that point, we sometimes find that in the EMIHS world, we will, and it's mostly for ALS, but occasionally BLS does come up, we will sometimes get sort of a cold request within the portal for us to do something or approve something. And the first reaction I might have, or others, is that might have sort of jumped the gun. If there's an order of things for our clinicians to do, an order that our clinicians have to take in order to make these inquiries from the beginning, would it be reasonable for me to make sure we direct them to the academy so that the academy first knows what they're trying to do and can help them help guide them in the process, so that when they actually do then need to go up to EMIHS or even the medical director for any type of approvals or vetting, specifically the affiliation step, that then it's not it doesn't raise questions about why is it here prematurely. Would that be the way? Just make sure that you're known, the academy knows what you're trying to do.
So I just want to make sure, so since for about 12, 18 months now, Megan Harrell at headquarters has been in charge of signing off on all of our affiliations, both ALS and BLS. So, if there's a question about affiliation, the first person to contact would be Megan. But usually that entire process is kind of behind the scenes. You put in your application and it's already being processed by both MIEMSS and by Megan and by the academy. But if there's any questions specifically to affiliation, Megan would be the best person to talk to. And then if it's about classes and, hey, what are my steps in order to get my reciprocity or my renewal, then the best person to talk to would be to email me at the academy.
So to I guess, clarify our thing, I probably didn't do a good job, I guess, explaining it. So what's going to happen once you do that reciprocity application? Like I said, you were inactive. So that would be the time I think you would probably want to talk to you guys, and that's when you would get all that stuff checked off. When you want to move to active, that's a second application. That's when you would have, I don't mean to read anything into it, but that's what I think would be the best time to talk to Megan and whatnot. So that first application, you'd probably want to come here and talk to the CAP, and then, that's just me looking in.
Right. So. And then it may be worthy of note that Megan is working with the new office service coordinator at EMIHS, Christina Chung. Welcome, Christina, to the team. And there'll be an overlap period of time, but it's possible that the civilian will be taking over that. The civilian position will be taking over that process in the future. So it's worth mentioning that, because we only do these videos from time to time. My only other thought was going to be sort of in the overall cheerleading and medical realm. So I wanted to toss it back to see if there's anything in the logistic, operational, and educational realm.
I just appreciate, Dr. Stone, Aaron, you guys taking the time to get this information out. I know it's been a little bit of a rapid transition for our clinicians, and so there were lots of questions. So hopefully this helped clarify a lot of that for them. As Matt has said multiple times, everybody can email me with any questions, but I do truly appreciate you guys taking the time to help clarify some of this for our clinicians.
Yeah. Aaron, do you have any other final notes or pointers that you can deliver?
I think I want to thank everybody for watching this now. One of the things that I've noticed in my time, I've spent 30-something years. I started here in Montgomery, grew up in Montgomery County, and really I can take any of my EMT skills back to my EMT class that I took here, and I can look at the training that I got back at the station and things like that. And then I can see how it works throughout the entire state, and everybody really is trying to do a really great job. And I'm hoping that some of this will have more impetus for people to do that, firehouse training. That's how I learned. That's how I really got the information drilled into my head. Is not just by me taking the class, listening to it and whatnot. It was, we would go back to the station and then everybody would drill me on it. And then the next group would come in and then I would drill them on it. And the next group, we would all be, so it's really, that grassroots training is what I like to call it. And I think that's an important aspect that this can really help with, and it can help us so that you guys can come in here, knock out all the skills in no time at all, and be good to go.
Yeah, and they're all perishable skills. So
Yeah, absolutely. That is what we were saying. You wouldn't want to tell our audience what year that was you were talking about.
When I started, 92.
There you go. Well, you're a youngster compared to even
Yeah.
me. So, so what I was going to do, and I think that's a good segue for what I was going to talk about when we talk about the cheerleading role I mentioned before, and the medical consultancy that I talked about. When I think about the evolution of EMS, and now just earlier last year in 24, we celebrated our 50th anniversary of ALS in the county, which mirrored the 2023 anniversary for EMS, organized EMS in Maryland. When I think of where we've been and how far we've come, I think that it's important to pause and reflect about the fact that no matter where you are in the accommodation service volunteer career, that EMS is a profession, right? And that's one of the reasons why we talked at the ALS level, for instance, about professional development. And it didn't come without some of its growing pains and controversies, and certainly it demands more of our ALS clinicians. When I look at this change, I see an analogy in describing this as moving us at the BLS level towards development of your profession, professional development, in that, as I was saying, rather than the 444 and the 12, we're looking at 5 different areas added to the medical and the trauma. And I just want to take a couple minutes to expand on those examples that I gave. If you look at those 5, airway, cardiology, obstetrics, pediatrics, and tox, think about how consequential knowledge in those areas are, and think of how much they're associated with bread and butter encounters we have every single day. I talked about the OB. It might be an example of a lower frequency but very high impact type of call to run. And an example of something I learned I wanted to share with you all, and that was sometime earlier this year, I had the opportunity to go to our EAGLES conference, which is the consortium of major medical EMS medical directors in Florida. And one of the guest speakers was a Surgeon General of California, an amazingly astute, obstetric-trained public health expert. And one of the things she brought out is that the mortality and morbidity from preeclampsia in the postpartum age group, which is relevant to one of the brand new protocols for 2025, which the hypertensive disorders of pregnancy, which has a BLS section in it. She pointed out that where we're losing the health of many of these women is ones that didn't, for some reason, get to their 6-week postpartum appointment. And sometimes, if you come in with a slightly high blood pressure to the ER, it doesn't make a lot of ER docs nervous about, someone with a higher blood pressure, white coat syndrome, people are running 140s over 90s all the time. But if the ER doc, for instance, were equipped with the fact that it's a person who had a baby, 8 weeks, it's less than 8 weeks ago, and now they're 140 over 90, it's like, wait a minute, that then becomes a red flag. And so something as simple as the knowledge that could be bestowed in a 1-hour OB section when they're looking at the latest, science, 1-hour OB section could potentially alert an EMT the fact that if you just get the history of the fact that a woman in childbearing age had a baby 6 weeks ago, and then suddenly you're looking at, you take your regular blood pressure, it's 150 over 100. It's like, normally that wouldn't, but if you know that, hey, wait a minute, that's not really normal, and you just relay that to the emergency department, we've had people then who leave the ED with a 6-week appointment and medication for that high blood pressure that normally wouldn't be a red flag. So there's a nexus to what the Surgeon General in California was talking to us about and how it could affect BLS education in a low-hanging fruit way. And almost any EMT could have the skill of better history taken and being alerted to that. So it now expanded to toxicology, where there's new drug dangers like xylazine and others. Everybody knows that when you have a pediatric patient, you take your own pulse first. You've heard that expression. And so, our pediatric readiness is something we're working on all the time. So if those things are in the curriculum, this is where I'm a cheerleader of the fact that this is professional development at the BLS level. And I didn't want to leave our 60 minutes without being a consultant and a cheerleader for that. And I think that that's one of the things that I'm, one of the reasons very happy to be here. And again, look at all, 2,000 of you and say, this is where the rubber hits the road. And if we're patient-centric, this is why we're doing this. So, thanks.
Awesome. Yeah, no, a good overarching kind of overview of this process and the positives that it has. So that pretty much brings us to the end of our 60 minutes. I didn't see any other questions drop in here, so I'll remind everybody one more time that if you do have any individual questions about your individual situation or the process going forward, email Captain Hayunga. He'll be either get you the answer or forward it on to make sure the appropriate person can answer your question. So again, thank you to Aaron for taking the time out of your day to meet with us and answer a lot of these questions and clear this up. We really appreciate your time. And thank you to everybody for watching, who's watching live, and those who will watch later, and have a great rest of your day. Thank you.